Hey, this is Jason, CEO of JTC Blue Collar Developers here in Oklahoma City and in Tulsa. I want to make a series of videos to let you know the blue collar response to the coronavirus scare and fears. There's also a lot of first responders out there in the world, medical technicians, labs, and things like that working out in the rain. We believe that we can pull our resources together. I've been talking with the general contractor customers we've worked with, and we all think that we can build containment facilities, disinfectant labs, testing mobile offices out of the shipping containers. We can just make a few modifications to take our blue collar scope of work and design it to create a community action plan. So this is what we're talking about today. What is the blue collar response to the community action crisis that we need to have? This is our plan. Two types of things we plan on doing to get us through this 3 or 4 months of the virus out in the infection going through our community. First and foremost, we like to keep our blue collar guys alive with funding and keep them well funded with a lot of work. I think FEMA is releasing a lot of money. Hospitals, nursing homes, even dental clinics are asking about disinfecting processes, entry and exit checkpoints, and make sure that we can make sure the forms and the paperwork are done out in the parking lot instead of inside our buildings. And on the West Coast, they're using tents and other kind of triage tents. That ain't gonna work here in Oklahoma. We got tornadoes and storm seasons of hell, and we don't need that biohazard blowing all over the country, creating crisis number 2. First thing we're gonna do, build virus protection checkpoints. We're doing type of training called ICWA, and that's our second thing. We're doing training and community preparations, processes taught by doctors and infection control professionals and even hazmat professionals. So we're gonna do that. We're gonna shoot on video. That's item number 2. But to break down the building of the protection checkpoints, container labs, triage clinics, things that can go up temporarily. We're doing it on shipping containers, but we can also put them inside foyers, build containment labs in everybody's foyer as we go in. Entrances, hospitals, nursing homes, retirement centers, dentists, they're all needing these checkpoints. We can build them really well. Shipping container testing labs, we already talked about that. Hazmat crews coming in with hazmat gear and disinfecting things. We can keep our blue collar jobs alive with that, keep those guys with the money to be able to afford medicines and protective equipment for their family. Second thing we're gonna do, training videos. We're doing one on April 1st here, taught by Dr. Boyer, 30 years in occupational medicine, and he's going to tell us about the little facts that we know about the virus and things that we may know to treat the virus and protect our communities at these checkpoints. So infection control training, virus related, free to the public. We're going to do a part where we're building the containment inside a house, inside a business. It comes right inside your, like another entry into your work, but it's infection control entry. And we're going to build these and show you how to do them in houses, so it'll be free to the community. Find our Facebook, our Twitter, our LinkedIn, and anything that'll allow us to be able to help prevent these things from spreading. Infection control training is the number 2 thing. We're seeing a lot of nurses and a lot of doctors and a lot of people putting themselves in harm's way. We believe that we can do things and build our careers. These are training documents that we'll do for our electricians and for our low volt technicians, for our carpenters, and OSHA training. So we're going to keep on going and growing in the blue collar community for our people. But once again, let us do infection control prevention. Share this video with anybody that you might know. We don't know who to talk to with FEMA. We don't know who needs building labs. We don't know the nursing homes that could use a facility to test in the parking lot before people coming in. Let us know your good ideas. We can use this social media at JTC Blue Collar as kind of a hotline, and I'll get word to the representatives and the other people we're working with, other general contractors. Please, if you let us know what we can do to build things to prevent this, I think we can make it through this hard time, especially in the financial terms, but also well as prevention and control. So we need to be helping our frontline nurses and doctors control the virus. So what can we do? What can we build? Please put this information out there, and I appreciate it very much. Thank you so much.